I represent the good people of Oshodi Solo, Federal Constituency 2, and from Lagos. I rise to move the motion on a bill for an act to amend the Medical and Dental Practitioners Act, CAP M379, Laws of the Federation of Nigeria, 2004, to mandate any Nigerian trained medical or dental practitioner to practice in Nigeria for a minimum of 5 years before granted a full license by the council in order to make quality health services available to Nigeria and for related matters. HB 2130 to be read for the second time. Thank you.
Those in support, say aye. Oppose? Okay, Honorable Abonda. You see what I'm saying?
I have an eyes of seeing bills that will not move on well. Mr. Speaker, you're a lawyer, a constitutional lawyer. What this bill is asking is offensive to rights, occupational rights, and all whatnot. Let me take it again. The bill is asking that any Nigerian trained medical doctor must mandatorily train 5 years before he can be given license. After qualification, after license, you must work here 5 years compulsorily. That's not obtainable in any clime. Mr. Speaker, thanks to President Babangida, who then, before then, when you qualify as a lawyer, you do a tutelage, not even mandatorily. You do a tutelage in any chambers of your choice before you can start your own chambers. That law was seen as oppressive, retrogressive, anti-human rights, and it was abolished. That the day you leave law school, you can start your chambers. Now, this bill is saying, very beautiful bill, he's trying to make sure we don't have brain flight and all waters and so on. Except you are giving them free scholarship to train. A parent may train the child in a medical school for 4 years, he qualifies. After 7 years, graduates, licensed to practice a medical doctor. Now the state wants to conscript that person to work for 5 years in Nigeria. For who? You didn't give them scholarship. You didn't provide for them. It is anti-right. That's what this is asking for. Why won't I oppose it? I have somebody now who is in medical school. So if you pass it when the government didn't contribute a couple, then they'll come and do forced labor for 5 years. Haba, it shouldn't go. It shouldn't be. So how can you pass? I'm sure I want to draw attention to it. So if you see the purport of it, it's slavery. In a modern time, slavery. This occupational slavery. How can the parliament allow occupational slavery to be? Once you pass it, it becomes a law, but it's a bad law. So I'm trying to say it should be optional. If you now want medical doctors to stay, you can say, upon graduation, any medical doctor who wants to work in Nigeria will earn 1 million naira a month. Nobody will run. They will all stay. But when you don't have good pay for them, most of them, they will migrate to where they will. If I take a bank loan to train my daughter or my son to medical school, upon graduation licensing, you say you should come and stay here and receive 1,500 whatever a year.
Okay.
A month. It's not possible.
You've made your point.
Honorable colleagues, please, let us start on this bill and rework it and come back. The way it is, it's not proper.
Honorable Johnson, do you have a...
Once more, I'm Honorable Ganiu Johnson, representing Oshodi Solo, Federal Constituency 2, and from Lagos. Maybe after listening to the lead debate, he will change his mind. Now, what really prompted this, there was a motion that I raised on medical brain drain. And in that motion, I prayed for certain things, that our public health care should be upgraded to general hospital. Our general hospital should be upgraded to specialist hospital and research centers. Also, I prayed in that motion that welfare packages of our medical practitioners should be improved on through financial institutions and private sector and government. They should collaborate with government. I waited for a while. nothing happened. It was the reverse. I noticed that there is heavy decline on medical brain drain. From 24,000 to now, as I speak, we have less than 10,000 doctors in Nigeria. So that is alarming. So I now thought to myself that, okay, let us look at our laws, what is happening. I noticed that, look, the vacuum is that immediately after housemanship, you know, we noticed that most doctors, because of greener pastures, there is a capital flight from Nigeria abroad to UK, America, and all that. Now, government has invested so much money in training these medical doctors. On the average, apart, yes, the subsidy, yes, it is government, the subsidy in training medical doctors. Say on the average.
1 second, Honorable Johnson, 1 second.
Yeah. 3,000 naira. Unlike their counterparts abroad, in US, it's an average of $82,000 to $100. That translates to over 60 million in naira. Ditto, that's at the exchange rate of 750 naira per dollar. Ditto in UK. So if you realize, if they can now take advantage of our situation, okay, and now open their doors, because just recently in 2020, UK opened healthcare and visa to people. They were all going to UK and US too, and Canada. So what should we do? Should we fold our arms? So now, and I said, okay, maybe to give back to the society, that is to our people, after training you. Yes, we are not saying you cannot go abroad to make your money, but if government has subsidized your tuition, okay, I mean, to the tune of 40 to 150,000, the least we can get from you is that after your housemanship, before you are given full license, before you are given full license, yes, before you are given full license, at least you can give back to the society within a period of 5 years. So after 5 years, you are free to go. At least you've given back to the society. So that's the meat of this. So my colleagues, Mr. Speaker, sir, I just pray that my colleagues will see wisdom in this and support this bill. Thank you.
Seeks to cure. He has explained to us what the mischief is. Brain drain, which we all talk about and complain about. We'll take one or two more. Honorable Toby, you are no. You are partnering with Honorable Abonta today, so I don't. Honorable Ningi.
Mr. Speaker, I rise to support this bill because it has brought up a systematic way in which the country is going to address the problem of brain drain. Because like the mover of the motion, the bill has said, the sponsor of the bill, it pains us a lot to see that our skilled manpower, the way in which they are moving out of the shores of this country, it is something that we must stand up to address. And by bringing this bill, if it is adopted and passed by this House and concurred by the Senate and assented to by the President, is going to help this country in retaining the required and needed skills we need in improving our healthcare system in this country. Mr. Speaker, like he said, medical training abroad is very expensive, but here in Nigeria, the government is investing so much money and at a subsidized rate. So this bill is timely, I urge my colleagues to support this bill. In fact, at the public hearing level, I will make an input personally. If we like, we can make it a bit we can make it a bit flexible by putting an option. For example, rather than saying you should not be granted a license, we can say anybody who wants to live before 5 years, he should refund the government of Nigeria the money that was used in training him, and it should be determined at an internationalized rate, not subsidized rate that he earned in Nigeria. So we can have those options in order for the bill not to be too rigid. But this is a very good bill. It is going to help us a lot. In fact, it should be extended to other critical skills that we need in the country, not only medical profession. I support this bill with my...
Yes. Honestly, that's why...
I support this bill with my heart, Mr. Speaker, and I urge...
That's why I was very disappointed or upset when I heard that you lost your election. You are one of the very, very good legislators we have here. So we're talking about restraint of trade here, is what we're talking about. Monkey they walk, babu they chop. So you spend your money to walk these people, and then babu over there will go and come and chop them. Yes.
Once again, my name is Bamidele Salam. I represent the fantastic people of the North and the South, Egbedo Federal Constituency of Osun State. Mr. Speaker, I rise this afternoon to lend my voice of support in favor of the second reading of this very, very important bill, which has come forth. A few of the issues I would have enunciated have been spoken about by Honorable Ningi, who spoke well before me. But I just want to add, Mr. Speaker, that when there is a critical problem in any society, as leaders of the society, we must be courageous enough to give the critical solution to the problem. There is no two way about it. We are losing a lot of our skilled manpower to countries that ordinarily should be the ones that will even be helping us to build this manpower. I don't have any record of having any form of support from the government of most of these technologically or medically advanced countries in support of our medical education in Nigeria. Yet, we spend our hard-earned resource in training our medical practitioners only for them to harvest them with all the offers of better welfare and packages that are given there. Yes, I agree that we need to do more as a country to improve on the welfare of our medical practitioners, just as we must do to improve the welfare of other critical professionals in Nigeria. But that is not enough. We must ensure that we evolve means of retaining this skilled manpower in the country for a minimum period of time as canvassed by the sponsor of the bill. So, Mr. Speaker, I think it is very important for us to head-on address this problem by supporting the passage of this bill into law to ensure that whoever benefits from the heavy subsidy of training in this country, in the medical profession or any other profession whatsoever, is under an obligation to offer service to the country that has trained him and sponsored him for a minimum number of years, and then he can take his leave and go off, to any other part of the world as he wishes. So, Mr. Speaker, I support the second reading of this bill, and I want to thank the sponsor of the bill for being courageous enough to bring this up at a critical point in time like this. Thank you so much.
Amos.
My name remains Amos Gwamna Magaji, and I represent the peaceful people of Zangon Kataf, Jaba Federal Constituency. We are from Kaduna State. Mr. Speaker, sir, before, at the point of graduation of every medical professional, there is an oath that is taken, which is service to humanity. It is called the hypocritical oath. And I can tell you, Mr. Speaker, that majority of this medical practitioner I belong to a WhatsApp group of my university. Some of my classmates that are now abroad practicing, many of them didn't want to travel abroad. I support that. I support the bill, but that the license should be seized or temporary license should be given. I don't think it will help medical practice in Nigeria. Rather, they should give full license. Then if there's going to be a probationary period that a medical doctor will stay and practice, I think that needs to be looked into. But beyond that, Mr. Speaker, I think we need to declare a state of emergency on our health institutions. Many of the medical doctors and many hospitals, many of us seated here, cannot even go and do a small eye surgery in a hospital in Nigeria. Many of us, even if it means going to remove appendix, many decide to go abroad. So there's a need to really look at the health institution. Some of the reason why many medical doctors travel abroad is not just the financial benefit. But I stand here, Mr. Speaker, to support the bill, but also to add that we should declare a state of emergency on our health institutions. Thank you, Mr. Speaker.
Igbila, representing Gwe East, Gwe West Federal Constituency of Benue State. Mr. Speaker, I thank Honorable Johnson for bringing this bill. Thank you very much, Mr. Speaker. Now, I want to suggest that we look at how to rework this bill in itself, because as a professional myself, I do not think you should be able to practice with anything but your license, especially in such a critical field as medicine. How would you give somebody a temporary license? I don't know what that would imply. You need a proper license to be certified to practice. So the issue we're trying to cure is the brain drain. And that in itself, in my own opinion, Mr. Speaker, I think is a catch-22 situation that we're in now as a country. Do we try to restrict these people and impinge on their own fundamental human rights? Or do we start to provide for the resources that we need to apportion more resources to the medical profession? Because are we now going to start stopping builders like me, engineers? We have other professionals who are also jackpine, like they are saying the term they are using now. Is it only the medical profession that is a critical sector that we're looking at? So I am concerned about that aspect of saying they cannot have full-fledged licenses, and the fundamental human rights these Nigerians also have to self-actualization as well. Are we not impinging on that aspect of it? These are things that I think we need to look at critically. I am not in support of not issuing them licenses, but we need to look at what does the government need to do immediately. A state of emergency is good, but we need to look at the solution. Sometimes we use a hammer to kill a fly in Nigeria because we don't want to address the fundamental issues. So that is my position, Mr. Speaker.
Address the very fundamental issue of fundamental human rights institution. It actually allows you to deviate from fundamental human rights under certain conditions. If you have your constitution, go to 45(1). And one of those conditions is where it concerns public health. It's specifically written there, public health, 45(1). So if the government or we feel that to safeguard public health, this restriction should be put, then we have not violated anybody's fundamental human rights. So I'll just put a question. Those in favor, please say aye. Those against, please say nay. Ayes have it.
Medical and Dental Practitioners Act M379, Laws of the Federation of Nigeria, 2004, to mandate any Nigerian trained medical or dental practitioner to practice in Nigeria for a minimum of 5 years before being granted a full license by the Council in order to make quality health services available to Nigeria and for related matters. Second reading.
Bill is referred to the Committee on Healthcare Services.